A lot of your good stuff is in between the questions, too.
Was he filming that?
Yeah.
Okay, let's go.
We film, okay. So, what happens when somebody comes to the office? Do you take cultures? Where do you go from there?
Yes. In general, when someone has come to see me, they've been having a problem for a long time. There are many good family doctors and general practice doctors around. And when traditional antibiotics are failing, then someone may say, go see Dr. Patty, he'll probably figure it out. Once it becomes apparent that the original medical treatment has not worked, I will ask for a list of antibiotics from the patient's pharmacy to see what have they been on, and for the past 2 years. And I tell the patients it's for 2 reasons. Number one, it tells me what time of the year the patient's getting sick. Number two, I'm not going to give the antibiotics that did not work. I'm not going to waste the patient's time. If I see something where there's an antibiotic that has not been used, I will go ahead and place the patient on it. There are times when I will swab the nose and sinuses and get cultures to get the name of the bacteria, which antibiotics works and which ones don't. Mm-hmm. And we can design topical therapy in an irrigation to kill that bacteria. Now we know statistically that even if the cultures don't grow, that over 70% of the time it's a staph infection. And a staph infection has a bad connotation, and it should. People have heard of MRSA, which has become the bane of infections in intensive care units and hospitals. Well, now it's in the mainstream population. It's in children who have MRSA, methicillin-resistant Staphylococcus aureus, in pediatric adenoid problems, pediatric sinus problems, pediatric ear infections. So